Welcome back to my YouTube channel. Hi, everybody. My name is Ashley Agan, and I am an ear, nose, and throat surgeon in Dallas, Texas. And today I wanted to take some time to talk to you about what we call foreign bodies, which it's a very medical term, but in layman's terms, we're talking about when there's something in a place where it shouldn't be. For example, in the ENT world, little kids will frequently put something in their ear or in their nose, and we call that a foreign body. So I had a patient come in recently, and young 3-year-old with bad breath. And the parent was concerned because they couldn't figure out how to treat this bad breath. It had been going on for months. They had been doing the appropriate dental care with brushing, even flossing, mouthwashes, went to see the dentist, couldn't figure out why this poor child had such horrible, smelly breath. So after examining them, I discovered there was something in the nose. I kind of looked in there with my little light, and I was like, looks like there's something there that's not supposed to be there. I said, do you know, have you seen them, put anything in their nose before? And the parent said, no, they don't do that. We haven't seen them do that. But the child was so wonderful and allowed me to just use a little instrument to kind of pull this thing out. And it was hard to tell what it was. It was incredibly smelly. It was yellow, brownish, because it had been saturated with the mucus from the nose for, I guess, potentially several months. And it was maybe like a round piece of cotton or tissue or something like that. It was soft, but it kind of slid right out, and it smelled horrible. So it was kind of like, aha, here's the culprit. And so I think it's important to keep that in mind when thinking about bad breath. Sometimes with nasal foreign bodies, there will be like nasal discharge. So a patient might come in and they've just had, yellow, smelly nasal discharge from one side of the nose or the other. Usually it's one-sided. It's not like both sides like you would have when you have a cold, And so that is also a tip off. If you've just got smelly drainage coming from one side of the nose, think about, could there be something in there? Things that I've seen over the years, things like beads, like small beads or rocks tend to be like a very common thing for kids to put in their nose, or little small toys, Legos, like a small Lego. I've taken that out before. And like some of the, like if it's bigger or if it's sharp, sometimes it can be hard and painful to remove, especially if it's been there a while, because there's probably, the tissue inside the nose is inflamed. It can be tender. It can bleed a lot. So every now and then we actually have to go to the operating room to remove these if it's just too painful or too uncomfortable for the patient to be able to tolerate in clinic. But luckily with this patient recently, we were able to pull it right out in clinic. And the problem was fixed instantly. Other places where we see foreign bodies in the ENT world would be in the ears. So very commonly, I will see patients for just a routine visit for something else. And as I'm looking in the ears, I might look and see, again, like a little bead or a rock or the eraser, like the pink end eraser that's like on a pencil, that's like broken off and put in there. And we can usually remove those in clinic. I have a microscope where I can, look and then use my little small instruments to pull that out. Again, sometimes it's very tender because it's been there for a while and it can be inflamed and you can have infection there. And so every now and then we do have to go to the operating room to remove something from the ear, or if it's just really tight. I've had some cases where if it's a bead and it's smooth and there's just nothing to grab onto because it's just this kind of smooth round bead that's like perfectly wedged in the ear and you can't kind of get past it to pull it out. Those can be really challenging, even in the operating room. And then other places where we might see a foreign body outside of the nose and the ears, sometimes, in the throat. So for example, one that comes to mind would be like a wire grill brush. So the brush that you use to clean the grill, those little wires can break off and be stuck on the grill. And then you cook the hamburger or chicken or whatever you're having, and then patients will ingest that and it can get stuck in the throat. And so I have pulled out more than one wire grill brush in my day. So there's a PSA to never use those, never clean your grill with a wire grill brush. They just shouldn't make those because I can't even count how many times that has come up. It's such a common problem that we see in the ER, especially during the summer months when everyone is grilling. So that's more common to see in the throat. In young kids, we can have airway foreign bodies, which just means that it made its way all the way into the trachea. So the size of a pediatric airway is the size of a coin. And so things like food can be aspirated. If kids are running around while they're eating, they might choke and you might have like a piece of food in the airway. So I think like peanuts would be probably one of the most common things. And that's always a trip to the operating room to be able to remove that. I think that's about it as far as foreign bodies go. Let me know what you think. Comment below. Let me know if you've had any run-ins with a foreign body, either in your own life or with friends and family.